The Canadian Dental Association has released a policy paper to advise the federal government as it rolls out its universal dental care program. The paper follows consultations with Federal Health Minister Jean-Yves Duclos, provincial and territorial dental associations, and dentists from across Canada. The group has recommendations to serve as a roadmap for the Liberal government, and it urges them to have a national oral health strategy in place by April 2025. Well, joining us now to give us more insight into these recommendations is CDA President Dr. Lynn Tomkins. Dr. Tomkins, thank you again for your time today.
Thank you very much, Nima. It's a pleasure to be here.
Now, we're hearing about staffing shortages, worker burnout, and mental health issues in the healthcare sector. But where is Canada's oral healthcare sector when it comes to this in particular?
Well, first of all, before we get started, I would just like to say that we are pleased when the federal government decides that it's going to invest in the oral health care of Canadians. So, the staffing issue with dental offices is actually one of the big concerns for dentists because there was a shortage of dental assistants before COVID, and that's been exacerbated by COVID. So we are working with the Canadian Dental Assistants Association on a project actually to encourage more dental assistants to enter the field, distance learning, and so on. And we are asking the federal government to undertake an oral health staffing strategy as well as part of their initiative to deliver dental care.
All right, and according to this policy paper, Canada could see up to 9 million new patients as a result of this universal dental care plan. So, in addition to using existing clinics, according to these recommendations, what else does Canada need to do to meet this demand and avoid the wait times that we're seeing in hospitals right now?
Well, we certainly will do our best to handle the influx of new patients coming in. I mentioned our strategy with the dental assisting and the staffing issues. There are 16,000 dental offices across the country, so they're well placed to serve Canadians in almost all locations. But we do know that we're going to have to rely as well on publicly funded clinics, the public health clinics to help as well as our university clinics. We have 10 dental schools across the country who also treat patients in their clinics. So they're expecting a big influx of patients as well.
All right, ma'am. Now, your paper also highlights potential risk to dental coverage plans offered by employers. So, how big of a risk is this, and how can officials avoid something like this?
Well, that is also a big concern because two-thirds of Canadians have some sort of coverage under some sort of employer-sponsored health plan or a provincial or territorial plan. So, whatever program the federal government does bring in, we are concerned that it not disrupt the existing ecosystem of employer-sponsored health plans. Canadians value their dental plans, and we know that many Canadians would not be able to visit the dentist without having their dental plan. So this is a policy issue for the federal government, whether they work on it through finance. We would like to see them incentivize employers to keep their dental plans because we know that people value them.
People definitely value their dental plans. Now, Dr. Thompson, the CDA also points to non financial barriers that some Canadians have when it comes to dental care. Can you tell us a little bit more about these non financial barriers and how officials can address them?
Well, certainly geography is one. I did mention all the dental offices, but there are areas of Canada where there are not enough dentists. We have a bit of a distribution issue. We have enough dentists in Canada, but we do have a bit of a distribution issue. So, one thing we have been approaching the government on is loan forgiveness for new graduates coming out of dental schools to encourage them to go to areas of great need. That would go a long way towards getting young dentists to go out and discover the wonderful regions of the country where there is a lot of need for dental care.
All right, just about a minute left here, but what do we know so far about the total cost of this program following the implementation of these recommendations and whether this is a realistic number for officials to consider right now?
Well, we know that in 2019 and 2020 that the Parliamentary Budget Office did a costing based on the NDP's proposed program at the time. Those costs were between 9.6 and 9.9 billion dollars, close to 10 billion dollars. Now that was before COVID and before inflation, so we know that number is higher, and we do believe that that is an underestimate of the true cost. So whenever the government is interested in investing in dental care, we are certainly happy about that. But we would like to see the government release a full costing of whatever program they are looking at before they decide on the long-term plan.
All right, Dr. Tompkin. Now, just a quick 15 seconds left here, but what are the next steps for the CDA following the rollout of this report?
Well, we certainly look forward to continuing to work closely with Minister Duclos and his staff. There has been a lot of dialogue. They have really listened to the profession and to our concerns because we're the ones that are going to be doing most of the delivery of the care. So we do look forward to continuing to work closely with the minister and providing access. There are millions of Canadians that are not coming to the dentist, and we would like to see them come into the dental office, have care, and have the best oral health possible.
Looking forward to seeing this. Dr. Tompkins, again, thank you for your time today.